Hello, Ms. Smith. It's Kathleen. The nurse asked me to come in and provide some perineal care for you. I'm going to get the equipment and we'll get started. You want to first provide privacy. One of the things you want to remember, of course, is making sure you have your proper equipment. So we have our wash basin of water. We have our gloves. Notice in this one we have 2 washcloths. You're going to use one for washing and one for rinsing. We have a towel and we have an incontinent pad that's going to go up under them. Now, if you don't have an incontinent pad, another towel will be okay to utilize in this skill as well for the pad that will go under. Now, of course, we've already checked our water, so we want to make sure that our patient checks their water. So on test day, you would say to the patient, or the mannequin in this case, Ms. Smith, would you check to make sure this water is okay? Okay. And now again, you have befores. And of course, we're getting ready to provide care. We want to make sure we put our gloves on first. Once you get your gloves on, then you're going to place your pad up under your patient for perineal care. Now this is an incontinent pad. So I'm just going to go up under my sheet because again, we always have to maintain that privacy. We're going to go ahead and push her gown up out of the way so it doesn't get wet in the midst of us doing care. And we're going to go ahead and slide this pad up under her. Now, in reality, you may have to help turn your patient from side to side to get your pad up under them. But on test day, it's okay just to slide it up under there because you're on limited time in regards to demonstrating your skills. So you want to make sure you get that up under her buttocks really well. And that's to protect her bed from getting wet. Okay. Let's make sure we have it under her. All right. Good. Okay. Now what we're going to do is go ahead and just expose the area that we're going to concentrate on. And of course, that's the perineal area. Let's get her little leg turned correct. Now in this skill, when we're talking about perineal area, it's very important, again, that you look at the critical steps. There are 2 critical steps in this area as well, or this skill, so you want to make sure you do them exactly as they're written. Now, when you're doing perineal care for the female, you want to make sure that for the female, you're going to wash from front to back. That's very important because we can cause infections if we wash incorrectly. So when we're washing, we're going to go down on both sides of the labia. We're going to go from front to back, going down this way. We're going to change positions of that rag each time. We're going to go down the other side, change position of the rag again, and then we'll go down the middle. We're going to wash that way, rinse that way, and dry. Okay? So watch me as I do that at this time. You're going to wet your rag. Okay? Now, we're going to go down one side. Change position of your rag, go down the other side. Change positions of your rag again, go down the middle. Now, you're going to put that rag to the side and you're going to use your other rag for rinsing. So you have one for washing and one for rinsing. You don't want to use the same rag to wash and rinse. You would automatically get a no. You would fail that skill. If they have different rags at the site that you're going to go to, get one that's a different color, and that may help you remember which one you use for washing and rinsing, okay? Otherwise, you want to remember if you have the same color. So again, we're going to go down one side, front to back, changing positions, going down the other side, changing positions again, and then you want to go down the middle. Now, in reality, when we provide perineal care, we actually wash the pubic area and, of course, in between the legs and the thighs here. But on test day, you're just demonstrating perineal care. So that's what you want to concentrate on. So we're just going to wash this area. That's all you need to be concerned with. Now, we wash, we rinse, and, of course, we must dry. So we're going to dry, going down one side, pat dry always. Go down the other side. Changing positions of your towel and pat dry. Now, what we're going to do is actually turn her on her side to wash the back area, the buttocks area. So I'm going to go over, and right now I'm going to cover her up, and I have to let the rail up because I'm going to turn her on her side. Now, we've already let the side rail up because we're going to be turning her on her side. So you want to turn your patient over on their side. Of course, in reality, if they were able to hold on, you would let them do that. Now what we're going to do is wash the buttocks area. Now you're going to be coming from the anal area. You don't want to go back up into the vagina because we've already washed that area. So you're going to come from the anal area and you're just going to wash, still coming from front to back, okay? So we're going to do that at this time. Okay, let's get her situated. Okay, so we're going to position her on her side with the rag that you wash with. So you want to remember, if you have the same color rag, you want to remember which one you utilize. You're going to wash with soap. Okay, so we're going to come from the anal area. Okay, you're just going to come up and wipe. Change positions. Change positions. In reality, of course, we will wash the entire buttocks, but again, for testing purposes, you're showing perineal care, so you just want to wash from the anal area. Now we're going to rinse with our other rag. Very important to remember that. We're going to rinse her off. Changing positions again. Now we're going to dry her off. Again, just pat dry. Okay. Once you've done that, now you're ready to get her back in position to lay down. And we're actually going to remove the incontinence pad before we go over to the sink to get rid of our water. Miss Smith, I'm going to just take this from under you, okay? Good. Remember, don't put that next to you. I can lay it right here for a moment. I'm going to pull her gown back down before I leave her. Now I'm ready to go over to the sink and empty and rinse and dry my basin. So if you would, follow me to the sink. Okay, now we're going to empty, rinse, and dry. Again, in reality, if you were doing it on a live person, you would pour this water into the toilet. But in that we use a mannequin, it's okay to use this sink. Empty, rinse, and dry. Once we've done that, we're going to place it in the designated dirty supply area. Now we'll go back over and get our linen. Okay, we're going to get rid of our linen. Okay, we're going to go back over to the bedside to make sure Miss Smith is okay. All right, once you've gotten rid of your linen, you're ready to remove your gloves. So we're going to take these off. We're going to throw them away. And we'd say we'd wash our hands. Now, you want to make sure that your patient has their call signal before you leave the bedside. All right, Miss Smith, here's your call bell. Just give us a call if you need us. Make sure the bed is in its lowest position. This skill is now complete.